Hey guys, I'm Joel Campbell, and today I'm going to talk to you about my career and why I chose it and why I think that it's important and how I use science, technology, engineering, and math in my everyday work. Neurology is the study of and the treating patients and diagnosing patients and with brain disorders or diseases, diseases and disorders of the spinal cord or the nerves or the muscles or a combination of those things. We see a wide range of patients. I'm an adult neurologist, so I see patients range their ages from 18 all the way up to, I think, one of my oldest patients is 100. First, you need to go to college and graduate with a bachelor's degree, a 4-year degree usually. It doesn't necessarily have to be a science field. You can do a non-science field, as there are certain prerequisites to get into med school. You'll have to take biology, chemistry, physics, etc. But you can do this and do this as an English major, for example, and still get admitted into medical school. There are lots of other things that you need to do, such as taking a medical admissions test, as well as possible research, various extracurricular activities, and things of that nature to help you stand out. So in medical school, it's sort of similar to college in the fact that it's an additional 4 years, where the first 2 years or so, traditionally you're studying, you're doing a lot of book work, you're in the labs, you're like in the anatomy lab, the microbiology lab, and learning a lot about human physiology, and you're also learning about pathology. The second 2 years, you're spending a lot of time in clinics, in hospitals, as well as operating rooms, learning about the different specialties in medicine, trying to help figure out what you want to do. Because the next step after medical school is residency. And this is where you have specialized training in that field that you chose. And residency can be another 3 to 7 years after medical school. Now, there is even additional training after residency that is not absolutely necessary, but a lot of people do it, called fellowships, where you have subspecialized training in your certain specialty. You have what we call continuing medical education, where every year you have to continue to, in order to maintain your license and your certifications, you have to prove to a certain extent that you are continuing to stay atop of the latest and greatest news in your field. But the goal really is, if you want to become a physician, is starting out doing well in college, because it is fairly competitive. And if you do well in college and you're doing well on the medical admissions tests and you're a well-rounded individual, I think that will help you greatly in achieving this goal. First of all, in neurology, a lot of what we do is diagnostic medicine. So people come in with certain complaints, certain issues, certain symptoms, okay? And we take that history along with additional information, okay? We do a neurological examination, which helps us localize, we call it localize a lesion, trying to figure out, okay, is this disease that is primarily originating in their muscles or their nerves, the peripheral nerves, or the spinal cord, or is this originating in the brain? And we use a lot of different diagnostic tests to help us figure that out. These include images, so imaging like MRIs, magnetic resonance imaging, or computed tomography, also known as CAT scans. We do lumbar punctures or spinal taps to analyze the spinal fluid to see if there's any markers that would help us figure out what's going on there, and especially if you're looking for an infection or an inflammatory or autoimmune disease. We do nerve conduction studies and what we call electromyography, which we're looking at the muscles and nerves to see what if there's damage in different areas and what type of damage that is, which can help us figure out what the diagnosis is. We do something called EEGs or electroencephalography, which we look at brain waves. This is especially helpful for patients that are confused or altered, or patients that have seizures, or patients that have memory problems, and we're trying to figure out if there's certain patterns into their brain waves. And then we use all this data. We also do blood work as well, but we use all of this data, all the diagnostic data, the neurological examination, the history, and then we come up with a diagnosis. And then after that diagnosis, then of course the next step is what can we do to help the patient? Okay, so what can we do to help treat the patient? And then after treating the patient, in neurology, a lot of the things that we treat are chronic, so it's not necessarily something that we can just fix. It's something that we have to manage, help them, number one, feel a little bit better, but also help them be stable and try and help them from preventing them from getting worse. Becoming a physician and of any kind really takes a lot of time and effort. Okay, so you're spending the vast majority a decade or longer, which is usually in your 20s, which can be some of the best times of your life, studying and working hard. Because after college, if you combine medical school and residency just alone, that can be anywhere from 7 to 11 years. And then you have fellowships, which can be an additional 3 years. So after college, you could spend up to 14 years in additional training before you're actually out and practicing on your own. Getting a complicated case or the mysteries, okay? This patient might have come in and has seen multiple doctors, multiple specialists, possibly even multiple neurologists, and they're coming in for a third or fourth opinion. And being able to take all of that information, do additional testing, and kind of fit the puzzle pieces together and get a diagnosis is probably the most rewarding part of my job, because oftentimes patients, they want to feel better, but they oftentimes just want an answer. After several years of not knowing what's going on, sometimes providing them that answer gives them a sense of closure in terms of what's going on, regardless of the next steps and how we treat and manage that. What I think is great about medicine is constantly changing and adapting as we do more research and gather more information and learn more about certain diseases and how to treat them. There's always new medications and new therapeutics coming out. There's always new diagnostic methods in order to help get to a diagnosis faster. Okay, and there's even some new disease processes that we don't understand and new diagnoses that are coming out. So the fact that it's always changing means that you have to always be learning. And so you're kind of a lifelong learner in the field of medicine, especially in the field of neurology. So what that means is, although neurologists are considered experts in diagnosing disorders and diseases of the central and peripheral nervous system, you have to constantly learn, or else you're going to be behind. And that right there is something that I aspire to, and all physicians should. I think it's a great field. It's one that you can use science, and if you're really interested in science, to help people. Okay, and so it's not just that you're You love science, and that's great. But at the end of the day, if you can come across to where you understand that I'm using this to help somebody, a lot of people get a lot of satisfaction with that, and that can be very satisfying.